Good afternoon, everyone. I'm Governor John Carney. It's good to be with you here for our weekly press conference on Delaware's response to COVID-19. I'd like to start off with some good news. You'll remember in our press conference last week, we talked about being added to the out-of-state quarantine list for the states of New Jersey, New York, and Connecticut. And at the time, I expressed my displeasure with that and the argument that we had that we frankly were doing okay criteria-wise, and we certainly weren't in the same ballpark as the other states that were on that list: Florida, Texas, California, Arizona, and states like that, Louisiana, and that we were just kind of on the borderline of the two criteria. Well, today we learned, after working with Governor Wolf in Pennsylvania, I talked to him the other day. We learned on Saturday that they had put us on their list. I talked to Governor Murphy last week, and our Chief of Staff and public health folks have been talking to their counterparts in New Jersey, New York, and Pennsylvania. And we were taken off those lists today. Part of it, first of all, I want to thank Governor Wolf and Governor Murphy, Governor Cuomo, Governor Lamont for their listening to our arguments. The reason that we've been removed from the list is because our data meet their criteria. My argument has been that with respect to New Jersey, New York, and Connecticut, the two criteria that they use, which are a 7-day moving average of the percent positive COVID-19 cases as one indicator, and the number of cases per 10,000 being under 10, meeting 100 cases for 900 million. So 10 cases per million. We're at 970,000 in our state. Really penalized Delaware for testing aggressively into an outbreak, the outbreak that we had among the beach communities, which pushed our numbers above that second metric, while we were 50% better than the metric on percent positive, which is one of the primary, maybe the primary criteria that we use to analyze our situation day to day, because it is a function of the number of tests we're doing, and we're certainly doing a lot more tests than we were 3 or 4 months ago, and the number of the amount of COVID-19 spread in a particular area. So thank you to Governors Wolf and Governor Murphy, Governor Cuomo. Thank you to the people of Delaware for leaning into that outbreak that we had in eastern Sussex County. And it is a kind of a wake-up call for us that our ability to manage our situation here and the number of positive cases by wearing face masks, by keeping social distancing, by avoiding large gatherings, by following the guidelines and restrictions, will keep us out of the jeopardy of going over these criteria. And we are still kind of on the margin in both of those criteria in terms of percent positive. We're below 5%, and we'll show that in a minute. I'll show you some other indicators that compare us with the other states that are on the list to show that there's really no comparison between the situation on the ground here in Delaware and the situation in those other states, which were really the target of their out-of-state quarantine. And we'll also talk today about the reopening of our schools. Both of these should be significant motivation for us to follow the guidelines, to follow the science, to take precautionary measures to keep ourselves and our families safe, and to do everything we can to keep our numbers low. Because as we'll see in a minute, the report that we've gotten from the special committee looking at the reopening of their schools, and Secretary Susan Bunting is Secretary of Education, is with us today, really focuses on three different scenarios, which are a measure of the wellness, the health of the community in our state. And so it'll be a green category, which is the safest health condition in the state, a yellow category, which is a hybrid of good and bad, if you will, and a different approach, and then a red category, which is keeping schools closed, and we don't want to be there under any circumstances. And so it really is up to us, and if we ever needed a motivation to wear a face covering, to keep social distancing, to avoid large gatherings, this is the motivation, which is so that all our children, all our grandchildren, our neighbors' children can go to school and get more in-person instruction than they otherwise would have if the conditions on the ground don't warrant it. So we're going to reopen the schools in a safe and sound way with the objective of making sure that every student gets as much in-person instructional time as possible in a safe way, with the emphasis on being safe. We had a long conversation on the White House call just yesterday about the outbreaks in states across our country and the actions that our governors are taking in Texas and Arizona and Florida and Louisiana and other of these states that have experienced a much worse outbreak than we have here in the beach communities. But the demographics and, to a certain extent, the scenario is the same. The young adults enjoying the summer vacation time at beach and vacation areas, in bars and restaurants, spreading the virus. It's the same situation in Florida, in Southern California, not so much in beach areas, but certainly the Gulf Coast beach areas in Texas and Galveston and those places. And each of these governors were sharing their experience with all the other governors on the line. And the message for them was they've been closing down bars and moving backwards, as the governor of Governor Newsom in California has done, particularly in the Southern California area. And it should be a wake-up call for us. We had our wake-up call with respect to the outbreak in the beach communities here in Sussex County, which did set us back, which did marginally put us on these quarantine lists from states in our region. I would still argue that we didn't belong there, happy to be off, but it ought to be motivation to stay off those lists, and more importantly, way more importantly, to make sure that we're able to open safely schools in the end of August, beginning of September, in a way that we can instruct our children in person as much as possible. Dr. Bunting's here to talk about that. So good news today to start off with us being released from the quarantines in Pennsylvania, New Jersey, New York, and Connecticut. Our cases are improving a bit, but we're still not where we were a month ago, and we'll show that as we move through the slides. So we're almost to 13,000 positive total cases across our state. Our new cases there are on a moving, 5-day moving average of 92. You heard me talk about just a minute ago the Pennsylvania or the New Jersey, New York, Connecticut criteria, which basically has us being 97 or thereabouts and under. 3.8% positive. The target there is to be under 5% positive, which is the World Health Organization standard, and it's twice better the standard of Pennsylvania, New Jersey, and New York, by the way. And so those two measures are going to be what the public health folks in those other states look at to keep us off that quarantine list, and we don't want to go back on the quarantine list. Sadly, 518 total deaths, although those number of deaths have really has not increased by a significant amount and recently, thank God, and we're down under 50 current hospitalizations. I've always pointed to that number. That is not a number that even plays in to the calculation of the other states with respect to quarantine. For us, it's a very important number because we know how real it is. We know the criticality of those patients, and you can see only 10 are critical hospitalizations. And it is an indicator of the seriousness of the illness that people are getting in our state. One of the things that we know, and it's a little bit sobering, is that a lot of the positive cases are with people who are non-symptomatic, who don't feel like they're sick. And it's disturbing because that's the first indicator for somebody to go and get tested. But if you're not feeling sick, there's not as much of a motivation to get tested. And of course, we're encouraging people, whether they're symptomatic or not, to get tested so we have an idea of the spread in our community, both symptomatic and asymptomatic. So 5,800 positive cases in Newcastle County. Kent County is increasing a little bit. We haven't seen much of this, but they light up a little bit on the map in terms of having percent positive a little bit above 5%, or at least on an increasing basis. And so we need to take a look at what's happening there. 5,100 cases in Sussex County. We're going to see in a minute the difference in percent positive each day for testing sites in Sussex County a week or two ago as we were really experiencing the outbreak. Again, the breakdown in terms of the number of cases by age group, again, that young adult category continues to grow with respect to the number of positive cases there. You can see the 18 to 34 bar is the largest. It's also a pretty big cohort, so the rate of cases by age is, for that middle age, the young adult and the middle age, 35 to 49, about the same in terms of the rate of cases. We're still looking very good on the dashboard for personal protective equipment. We're very focused on this as we move into the reopening of the schools, recognizing that there'll be school nurses and other personnel who will need protective equipment. We also know of the need for that protective equipment for our nursing homes, and we're doing a much better job, it must be said, in protecting residents of nursing homes, getting nursing home staff tested, and you can see that with respect to the hospitalization rates and those much lower fatalities than we're seeing. So here's a good look at our data dashboard, which again shows the two top left graphs, declining number of current hospitalizations, pretty flat, under 50% now, as I indicated a minute ago. The new hospitalizations tend to go up and down. Generally, you'll see a smaller number on a weekend and tend to jump up early in the week, but consistently moving down. The far right at the top is the percent who test positive. We've been doing a lot more tests, and so that higher denominator will have the effect of lowering the percentage if your number of positives stays about the same. And you can see that we're on a slight decline there after raising. This is a 14-day look. If you look back another 14 days, you would see an increase, and then this slight decline, and then the new positive cases each day. Again, the indicator that got us in trouble and on the quarantine list with with New Jersey, New York, and Connecticut now under that rate that of about 97 per day, which puts you on that list. They use a 7-day moving average, so it does smooth out some of those ups and downs. The last two graphs we've talked about a lot: the peak and then the decline, and then the gradual increase of by county and overall cumulative increase in the number of cases. And you can see where it started to flatten out, peaked there in the middle of May, and we're hoping that it was going to continue to just go flat across, and then ticked up a little bit at the end of June and early July. Here's the 90-day view. It gives a really good picture of kind of the classic logarithmic increase initially into late April at the peak, April 27th, with hospitalizations 337, just to give you an idea of where we've been and where we are today at 49. The new hospital admissions, you can see in the middle chart on the top, again, trending down from the peak and flattening out more recently. And then the percent of persons tested positive, you can see the little blip increase in mid to late June, and now hopefully going down again, and that's the objective. Same thing with new positive cases and then the classic curves at the two on the bottom of the right. Here's a blown up version of the percent persons who've tested positive going back to March 22nd, and you can really see the increase there. Now, remembering it accentuates this a little bit in the fact that we're not doing as many tests. So the denominator here in this calculation was smaller back then in the late April. But about April the 27th was where we hit our peak in hospitalizations, and so your percent positive and your number of cases peaked a few days before that, as hospitalizations and deaths certainly are lagging indicators. Then we had the nice decline as we increased testing and people started wearing masks. We shut down the sections of the economy, and we had, consistent with CDC guidance, we had more than 14 days of improving conditions in our state before we started reopening again, basically around June the 1st, just after Memorial Day, and then to mid-June to late June with the uptick there in eastern Sussex County at the beaches. And at the same time, it must be said that cases in the other two parts, the other two counties, Kent County and Newcastle County, could have been lower than, as well in terms of percent positive. They're just under a 5%. We'd like to see them lower than that. If we could get to 2.5% or lower, that would be a really positive thing. So the long and short of it is the virus is still out there, and it's circulating. It's being transmitted from one person to the other. So if we're not taking precautionary measures, we're not wearing face coverings and masks, we're not keeping social distancing, we're not careful about large gatherings, then we're going to see these rebounds. And in our state, we've seen two significant ones. First, both in Sussex County, one among poultry workers and their families, and in the enclaves in which they live in the small towns in Sussex County and Lower Kent County. And then this outbreak and this surge in the young adult kind of partying, bar, restaurant, lifeguard crowd there along the beaches. So until we have a vaccine, we're going to have these periodic outbreaks. We're doing a lot of testing to managing, and that's going to be our focus. So after that 30 days, as I mentioned, after 30 days of declining cases and hospitalization, we had this outbreak at the beginning of June, which really started to show itself in higher numbers in mid-June as we moved into the end of the month. And it started with really just kind of bad, with some complacency and some bad decision-making around senior week for high school students, and then as the bars and restaurants and the tourism crowd started the summer. So we've tested hundreds, and hundreds turned out. Credit to all the businesses and restaurants and hospitality industry in Sussex County and folks down there at BB Hospital as a partner in getting folks tested across Sussex County. We had a huge turnout in Dewey Beach there, a big turnout at Rehoboth Beach for coastal communities. And so the WHO, as I said a minute ago, recommends states stay below 5% positive to control the spread of the virus, and that's going to be our target. We're under that statewide, not quite there in the beach communities, but we expect to get there and stay there soon. So here's just a snapshot of where we've been, how we peaked out there in June at 7% percent positives in one of the lowest sites, and at 10% percent positive in the Rehoboth Beach, Rehoboth Dewey Beach. That's a zip code area. And then after that, we're just around the 5%. We want to keep under that. So we've done intense testing across Sussex County. When we saw the outbreak among workers in the poultry industry, we tested intensely in Milford, with Bay Health as a partner, in Georgetown with both Christiana Care and Beebe as a partner. We did a lot of testing in communities in Georgetown, in Seaford, in Millsboro, in Milford, as I said, very successfully. And we had, I think, two really positive things. One, we were able to get ahead of the spread of the virus, to isolate it, to get people's attention that it was a real problem. Obviously, to get the attention and the cooperation of the poultry processing plants, which allowed us to test all of their employees, which was actually turned out to be a very positive thing, because some workers who were not coming to work because out of fear that they might be working next to somebody who was positive, now there was a level of confidence that they can come back to work safely because we were testing everybody, and we tested close to 10,000 Sussex County during that period of time. Into June, when we saw the outbreak after Senior Week, we tested intensely, as I just said a minute ago, along the beach communities, Dewey Beach, Rehoboth. And by the way, we've just gotten tremendous cooperation from Mayor Coons in Rehoboth and the mayors of the other beach communities, Mayor Becker and Lewis, just in terms of they had some tighter regulations around mask wearing and other things where signage and the like. So here's a slide that shows the percent positive. You can see now where we're under 5% at 4.8%. Our neighbors, Pennsylvania, about the same area, Maryland, a little bit higher. And then you compare with the other states that we were grouped in with, Arizona, Florida, and Texas, that are in double digits and really having scary outbreaks. Will show that in each of those states, they didn't, unlike Delaware, that had a peak and saw improving conditions really over close to a month period of time. Those states really never peaked out. They got to a level, and then it exploded beyond that. New Jersey and New York really have done an amazing job. They were hit worse and harder than any state in the country in terms of the number of percent positive and the number of deaths, but they really have taken very aggressive actions, and you can see they've flattened out quite a bit. They're doing a considerable amount of testing. I think New York is one of the leading states in the country that way, which helps their percent positive because it increases that denominator. So this gives you a picture, an idea of where Delaware stands with respect to our neighbors, Pennsylvania, Maryland, and New Jersey, the states that have really had dramatic upticks. With respect to current hospitalizations, this makes them comparable because it's per million population, so you're comparing a state like Delaware with just shy of 1 million people with a state like Pennsylvania, which has, I think, 15 million or some very high number, higher than us. And you can see that Delaware, Pennsylvania, Maryland, New York, and New Jersey all had a peak, mostly around the end of April. But Florida, Texas, Arizona, they just kept going and have accelerated from there. I think if you change the scale there, you do see one of those states actually has a little bit of a rise and then a decline. So very different experiences. The dotted line there is the national 7-day average for hospitalizations, and so you can compare that national number to our number, and you can see that the national number and these other state numbers have started to increase again, where Delaware continues to bottom out on hospitalizations, and that's a really good thing. Another comparison with states in our region and some of these states that have really seen the dramatic increase, you can see Delaware, Pennsylvania, Maryland, New York, and New Jersey with a very dramatic peak. Again, about at the same time, there's pretty significant decline. And then in the case of Delaware, Maryland, and even New York and New Jersey, a little bit, but not as much, a little bit of an increase here over the last week or two. Florida, Texas, and Arizona, and states like that, you can see a continual rise never really had the 14-day improving conditions, which were the guidelines for CDC's reopening of the economy. So very different. Each state has had a little different experience with testing, and this is the number of tests per million. So you got to look carefully at this because the scale is a little different for each state, and so you got to look closely at the number 1,000, 2,000, 3,000 per million, and you can see Delaware is testing at a rate pretty significantly relative to other states. Again, New York doing very well at over 3,000 per million. Arizona the same. And so this does show you that when you start testing, particularly in a small state like ours, if you have an outbreak in a small geographic area, because of our smaller numbers, it's going to have a bigger impact. And so as we're testing into these outbreaks, we're going to see that come up in our numbers. Here's the chart that compares the deaths per million. Again, a little bit different. Each is a little bit different scale, but shows the peaking of that in most of those states. So the other issue that we're really focused on, and it's related to what the discussion that we've just had on the situation on the ground in terms of the number of positive COVID-19 cases in our state, the number of hospitalizations, the seriousness of the illness, the spread, is going to affect our ability to reach this goal, which as we start to reopen the schools in our state, our goal is to get to as much in-person instruction as we can, but to do in a way that's safe for students and, more importantly, to a certain extent for staff. I say that because staff, young people increasingly now still, are not infected at the rates of as older people are not as vulnerable to that, even though they can get very sick and have debilitating longer-term effects of that illness, and so we want to protect everybody. But increasingly we're concerned about teachers and staff, and so our focus is going to be opening our schools in a way that's safe based on the spread of and the existence of the virus in the communities, and we're going to see, though, we'd like it to be consistent across the school districts and across our state, but we've already seen how there can be geographic differences, and districts will need to respond to that. Every district's a little bit different in terms of the number of students they have, the configuration of their school buildings, their operational needs, and so the role of the Department of Education, Dr. Bunting's here to talk about that, is to use kind of some broad guidelines that have been established by our working group. They've been submitted to the department. The department has been working with those through the Division of Public Health to test them against the public health safety measures. And so the goal initially is to see if we can test as widely possible all the education staff to start the school year. We're still working on the logistics of that. Should have some announcement over the next week or so as to how exactly we would do that, but we want to test as many, if not all, the educators and staff to start the school year off, and then to have periodic testing in a way that measures any existence of the virus and the spread thereafter. So next is Secretary Bunting. This is the most difficult and the most important decisions that we'll be making over this last 4-month period of time. Difficult decisions as we closed sectors of the economy as I've issued stay-at-home orders, and then the reopening has been difficult too. But opening our schools, the most important thing that we do in state government, along with keeping our citizens safe in their homes and their communities, is as important a thing as we do, and going to be very difficult to do it in a way that's safe and that gets the educational instruction that our school children need from pre-kindergarten through kindergarten, elementary school, and high school, and there'll be differences in each of those. I want to thank the group of educators and public health officials and others that served on the working group coming up with the recommendations, looking at starting with what are the conditions on the ground. Are we in a green stage, which is the best of conditions in terms of the percent positive of people testing, the daily number of COVID-19 positive cases, our hospitalization rates, some measure of the health of the community. Best case scenario, scenario where you might be where we are today. You know, we're just kind of just on the edge of being put on quarantine lists from other states and on the edge of where we want to be in terms of 5% positive cases in our testing, and where we might have to have schools and school districts doing instruction in a more hybrid kind of way. And then worst case scenario where we see widespread effect of the coronavirus in communities and have to keep the school buildings closed. So Dr. Bunting, thank you for the good work that you and your staff have been doing and will continue to do in helping us make these difficult decisions that will be made with the Department of Education, working with each of the school districts. We had a good call on the conference call this morning with the superintendents and look forward to working with them. Dr. Bunting.
Thank you, Governor. Recognizing the true importance of the decisions that have to be made about returning to school, and also valuing the voices of our Delawareans. About 2 months ago, the Governor and I comprised 3 working groups to address the various factors of reopening. Our guidance that is going to be released later today or sometime tomorrow gave a charge to those members, over 50 of our Delawareans, ranging from students to legislators, from health professionals to bus transportation supervisors. We ran 3 groups, one that accented the academics and equity issues that we would be looking at, another group that undertook planning for operations and support, and one that has gained a lot of interest from our public is the one that was geared toward health and wellness. So the guidance that you will be seeing coming out actually asked these groups to address 3 scenarios. One, which we sometimes refer to as the green one or scenario 1, would have minimal community spread, and we would be returning to schools for full in-person instruction if we had certain precautionary measures in place. Scenario 2 moved into a more moderate community spread situation, and this would involve our schools using a hybrid or a mixed model of instruction, some remote learning, some in-person learning, and depending on the conditions, we would have to make that adjustment. And again, the precautionary measures would definitely be in place because keeping our students and staff safe is a very high priority. And scenario 3 would be our school buildings being closed because of a significant, or sometimes we use a significant or a very strong, a substantial community spread. So the groups worked diligently over the course of 5 or 6 weeks to give us recommendations, and those recommendations are the basis of what you will be seeing in the guidance. We simultaneously had a dedicated phone line to take voice messages, and we had an email system set up so that 24/7 Delaware citizens who were not on these working groups could also give us opinions, concerns, ideas for how we could accomplish the educating of our students in the fall. So what you will see, as I mentioned in the reopening guidance, is something that districts and charters will use to support the continued development of the plans in their individual districts or charters. And if we think about it, this collaboration between the Division of Public Health and the Department of Education is really going to lay out what schools must plan for, and then the individual school districts have to take the task of making sure that this works in the particular school district according to their needs, their size, their buildings, their population, and so forth. And that will possibly take a different look in different places. We did also want to capture the voices of our actual parents, students, teachers, administrators, our educational leaders about their experiences with remote learning, because since the 13th of March, our students had to switch very quickly. They pivoted to a remote learning environment, and we finished the school year in that manner. So we wanted to get feedback from our public as to how that experience had been. We wanted information so that we could even be more effective if we needed to repeat that experience. And we asked a lot of questions. We got a lot of mixed answers. And just one of them here is illustrated. If you asked our students, they definitely would tell you they wanted to go back to school. And if you take a look at what adults might say, that differs slightly. And as you look at these three specific questions that were asked and the feedback, you see varying opinions about how adults feel about going back to school, what their experiences happen to be for the remote options, what they also think about the hybrid options. This is a survey whose results are on our website. You can read the entire document, and it really is quite interesting, particularly when you think that we were able to capture the opinions of over 20,000 respondents. Even though it's a mixed deal, we know that we are going to be looking at various scenarios that people are going to have varying opinions about. As we face whatever we are going to set up for our mode of operation under whichever of the scenarios is identified, and that identification, by the way, will happen in early August, we need to know if we have the funding to do so. So there is federal money that has come to the state of Delaware. The CARES Act funding immediately sent money that went out to districts. $39.1 million was directed to district and charter school operations. There was a listing of about 12 things that were possibilities, but in essence, this money has to be invested in situations that have been created by COVID. It could run the gamut from providing additional technology, devices, or infrastructure to feeding children. And these have all been concerns of ours as we move through those months at the closing of the school year. So districts can make their own decisions based on the needs of their, in particular, student body and their staff needs as well. We also had $12.2 million that came to the state. Some of this was directed toward a governor's education emergency relief fund. Some of it came to the Department of Education. We've collaborated, and our monies will be spent basically sending it out again to help what happens in districts and charters for our students. We have about $4.5 million invested, or will be invested, in instructional support when our students come back or when our students do not come back. In either case, there's going to be additional support. And we're also aware that we're going to need to perhaps provide after-school and summer activities for the students to make sure any gaps that have been created are filled. And again, that's the purpose of the COVID monies. This $4.5 million will also go to mental health support and the professional learning that our teachers need in order to be able to most effectively deliver instruction if it is not in-person instruction. $3.5 million, together we invested in digital classrooms, and that ran the gamut from connectivity, which is particularly poor on the western side of Kent and Sussex counties, expanding the broadband, and also the content filtering that is needed for our students to be safely using devices so that we know that they're using them properly. And $3 million is going to expand what we have grown to call our opportunity funding in the state. This would allow 41 additional schools, in addition to the 44 last year, to have monies that would expand services to English learners and low-income students, particularly in the realm of mental health, social workers, school psychologists, the social and emotional support people that we can put into schools, and in addition, reading interventionists who can help us with promoting their reading skills. And lastly, our money will be involved with a lot of trainings that we might have across the state. We did put a piece of that little bit, I think it's about $1.2 million that left into some of our pathways opportunities for our high schoolers. We also have a dual generation center that's operating here in Wilmington. So various supports and initiatives we're also taking care of with that money. Bottom line, our top priority is to make sure that we get the best educational experience for our students. We want to make sure that we prioritize the health and safety, but we also want to maintain that goal of providing high quality, equitable educational opportunities for all of Delaware's learners. Any scenario that you look at involves keeping our students safe. And so you would be expecting to see in all three scenarios the use of face coverings, social distancing, and we also have transportation precautions that would be taking place on buses as they bring our students to us each day. We're hoping for as much in-person instruction as we can possibly provide because we know that's the richest way to go. But we also know that whether it's in-person or remote learning, there are pros and cons to the situation. And as the governor mentioned, we will be looking at the statistics, we will be looking at circumstances, and in the meantime, we're planning, before that big decision is made in early August, we are planning for the scenarios just in case. All three scenarios will be looked at, and our districts are working hard to make sure they are ready. With that, I would like to emphasize that the department is actually a support agency, and we exist to make sure that we facilitate the work in districts. So we're in constant contact with our superintendents. As the governor mentioned, as late as this morning, we were on for almost an hour to listen to the concerns and help plan and deliberate various aspects of what we have as a tremendous task ahead of us. I'd also, though, like to be extremely open about our appreciation for the people who have contributed to the guidance. The work group members, as I mentioned, over 50 of them. The leadership, we had one member of the department and a member of the public leading those groups, and they spent hours in order to provide the guidance that is now out on the street, or will be by tomorrow sometime. But we also had, as I mentioned, parents and educators and school staffs and students and advocates and community members, all of whom cared enough to contribute to the guidance that we hope will lead our students to a very profitable learning year as we open the 2021 school year. Governor?
So thank you, Dr. Bunting. I'd like to thank all the members of the work group as well, parents, educators, staff, students, advocates, community members. A lot of really hard work. There's still a lot of work to do. That should be obvious, will be obvious when you see the report. I think the frame of it depends. When people say you work opening schools in the fall and how you're doing that, the answer is, well, it depends. It depends on the health of the community at the time leading up into it. We'd like to have a decision or some announcement early in August to give folks time to plan. But it ought to be really good and strong motivation for all the rest of us to make sure we're doing everything we can to keep the spread of the virus under control by wearing masks. If ever there was a motivation for wearing a mask, it's so that your son or daughter, your brother, your sister, your grandson or granddaughter can go back to school in the best way possible this fall and stay in school with in-person instruction through the fall and spring. All the public health experts tell us that there's some kind of rebound coming in the fall. We need to be ready for it. We need to have school communities that are prepared, that have changed their physical environments to protect the safety of teachers and students, and environments where our students can learn, and all of us need to pitch in to make sure that that can happen. Dr. Rattay, lots of work from the division, never seems to end with testing and all the rest. I appreciate the work that your staff continues to do for us.
Great, thank you so much, Governor. And from a public health perspective, we agree so completely with what you have just said. From my perspective as a pediatrician and a public health official and a mom of school-age kids, I feel very much in line with the recommendations of the American Academy of Pediatrics, which is that it is vitally important that we do everything we can as a state to get our kids back to school as much as possible with face-to-face environments as much as we can in the fall. I mean, students in school obviously receive important academic support, but schools provide so much more than academics to kids and adolescents. In addition, children learn social and emotional skills and exercise and healthy meals and access to mental health support, the internet, and other vital services. And many of these are difficult to get in an online-only learning environment. I had the opportunity to visit an elementary school with the DOE Deputy Secretary, Christina Loyce, who I just want to give a huge shout out to. And I was really shocked at one elementary school to learn that only 40% of elementary school students in that school had remained engaged in remote learning by the end of the school year. For me, that was really staggering and reinforced the need to get kids back in a physical school building, but we are absolutely obligated to do it in a way that keeps students and staff safe by using key prevention strategies and mitigating the potential spread for COVID-19. Now, there is some good news that the evidence to date suggests that kids and adolescents, children and adolescents, are less likely to have symptoms of severe disease. They're also less likely to become infected and to spread the virus. And that is, there's a new study that looks at kids who are ages 10 and under who seem to be less likely to become infected in comparison to kids 10 and up. And that helps us in the way we're thinking about safety for kids. But certainly it doesn't mean that the risk doesn't exist for any school-aged child, as well as the staff who are in those school buildings. So grateful for the collaboration that DPH has with Department of Education, and we have been working very closely with them to determine the best, safest ways to get kids back into schools. We've talked a lot about face coverings at these press briefings. The science is very supportive of this being probably the most important tool for keeping this infection under control. Because of some of the newer studies, we feel it's critically important for kids who are around 10 and older or grade 4 and older to be required to wear face coverings, and all adults, especially inside school buildings. Certainly for kids under 4th grade, we strongly encourage those younger children to wear face coverings, and especially if they are less than 6 feet apart in school buildings. Social distancing, again, we talk about it all the time here, and that's going to be key, very key to keeping kids and staff safe. Kids need to be social distance. Ideally, we aim for 6 feet or more. There is some science that supports 3 feet or more, as long as the children are wearing a face covering. We've talked a lot about hand hygiene, hand washing, and having access to hand sanitizers being important. We've also talked a bit about the importance of utilizing outdoor spaces. We've seen some innovative approaches in other states, and we know that we've got a lot of innovative leadership here in our state, and it's a good time now to start thinking about utilizing like event tents and all the outdoor space that may be available to our districts and our schools to get children outside as much as possible during the school day. Again, cleaning and disinfecting is important, and we'll be working with the schools on that. Additionally, on the next slide, we talk about the importance of risk assessments. It's important that that children and staff are not going to school if they have any signs of COVID or should be in isolation or quarantine. And so we're working with Department of Education on we have a tool that can be used before kids and staff go to school in the morning. We have a long history of working with school nurses on infection measures. They contact our Office of Epidemiology on a regular basis if they're seeing infections. We have protocols already in place from the spring around COVID-19. It's going to be critically important that we continue to work with the school nurses on reporting cases to us and vice versa, so that we make sure that we have good contact tracing and isolation and quarantine of those who are sick or exposed. And additionally, each school will have a school coordinator, and we will work with them on social distancing and on cleaning and disinfecting schools as is appropriate. So the main point I want to get across is we will continue to work with Department of Education and the schools and the districts to ensure that we are, as a supportive agency, providing the support that is needed for schools to be ready and to progress through the year as we move forward. I want to pivot here for a moment and talk a little bit about statewide testing. We are putting on our website today a new updated testing plan. I'm calling it 3.0. Testing has evolved quite a lot from the beginning since February, when we had very limited testing, to testing only symptomatic people. For quite some time, our hospitals were really central and key to our being able to do testing. But we have evolved, we continue to evolve. And our goal at this point is that Delawareans have easy access to COVID testing of their choice when and where they need it. And also that we are getting results back as quickly as possible. So on the next slide, I talk about some of the balancing of needs, which is we want this to be, again, easy and predictable for members of the community to know where they can get tested and to have easy access to testing 7 days a week. It's also important that we are flexible. As the governor's talked about, we respond to outbreaks like at the beach or with the poultry plants or in high rises where we see a cluster of cases or an outbreak. It's critical that we continue to be able to work with partners to respond and test. But also sustainability is key in our thinking. We want to use our resources as wisely as possible, which is a part of how our plan was shaped. So, of course, testing symptomatic people is the highest priority. But as we've discussed before, it's really important that asymptomatic individuals who are either exposed or are in high-risk settings like healthcare, first responders, long-term care, or other congregate settings have easy and appropriate routine testing, but also vulnerable populations, such as those who are elderly, who may have mobility concerns, or individuals in low income or minority populations. It's important that testing be very accessible in our communities across our state. And we also have been working more on enhancing our guidance around employer-based testing, which I'll talk about more in a moment. But on the next slide, you'll see that our list of testing options has grown significantly. We're going to announce some exciting news tomorrow about pharmacies. Pharmacies are throughout our communities across our states. Pharmacies are, in general, open 7 days a week, and so this has been key to the work we've been doing over the last month to increase accessible testing. But hospitals will continue to do testing, especially for those in the emergency department and inpatients. They will continue to run some community testing sites, primary care practices and urgent care, and sites like MedExpress or other specialty care centers are providing more testing, as are federally qualified health centers, who've also been great partners in our response testing, as well as, for example, Westside is testing migrant farm workers, which is so important downstate and in Kent and Sussex County. Our public health clinics will be, and we are now providing testing in each county, as well as it's important that employer-based testing, like in the school setting, is available And we also have newer and more options to take advantage of with home testing kits that we want to make sure people are aware of. So all of this is in our new guidance. In addition, as I mentioned, we have updated our guidance for employers. We've made it more succinct and I hope clear with a clear option of resources. This is in partnership with the Division of Small Business as well as DEMA. DEMA has developed a survey tool so that businesses who are interested in testing options can utilize this survey tool and reach out to us so we can work with them on the best testing options for them. And as always, all of these materials that I just mentioned are on our coronavirus website at de.gov/gettested. I'm really excited about this new tool that our team has just put up on the website. Now when you want to find a testing site, you can put in a zip code, you can put in an address, and you'll get a list of testing options that are as close as possible to that zip code, spanning out by distance as you go further down the list. And when you click on it, then you'll find more about those testing sites, more details, including links to registration. So we're really excited about stepping up that tool and making that much easier for the public to know what testing options are available as well. So I think that is it for me. I'm going to hand it back to the governor.
Thank you, Dr. Rattay. Really some exciting things, particularly the announcement later this week about your partnership with pharmacies. Really, I think, a real breakthrough kind of thing with respect to the ease with which a Delawarean can go and get tested and quickly and get the results fast. New testing technology is emerging and something that's going to make it a lot easier. One of the things, though, that we're finding, and this should be a message to all of us, is that folks, if they don't feel sick, they don't feel like they have to go and get tested. Before the outbreak there in eastern Sussex County, where there was a lot of public attention to the problem there, and we were able to get people to come and get tested even though they weren't symptomatic, we were having some difficulty filling out some of the sites. And so it should be a message to every Delawarean to take advantage of the sites, to go out and get tested, whether you have symptoms or not, so that we have some idea of the extent of the spread, so that we can fill up the testing sites when they're active. You'll have an opportunity to do it now at your local pharmacy, hopefully tomorrow. We'll touch on that again. But I keep going back to where we were at the beginning, where we talked about being released from the quarantines in Pennsylvania, New Jersey, New York, and Connecticut, and the motivation around creating conditions in our state where our children can go back to school for in-person instruction. If there weren't better motivation for us to follow the guidance and restrictions, to limit our exposure in public to large gatherings, to wear face masks in public all the time, to be conscious of and aware of the distance you are from everyone else, washing your hands, wearing your face covering, practicing social distancing. If we do all those things, we can flatten the curve like we did a month, 2 months ago, and be in a position where we can send our kids back to school for in-person instruction. So we don't have to worry about calling the governor of Pennsylvania, New Jersey, and New York to get released from their quarantine list, and so that people can be safe. We don't have to be as concerned about the risk to our elderly citizens and those with vulnerable conditions. But it's up to us. It's up to us to act with a sense of community and to take what are really simple precautionary measures, and that's everybody. We're asking everybody to do that. So with that, I know we have a number of people that are here. We appreciate, again, the attendance of members of the media and your help in getting this information to the public, because it's the only way that we can do the things that are necessary to keep our community safe. Meredith?
Hello. President Trump has demanded that schools, when they reopen the fall, that children are in the schools physically, and has also threatened federal funding if that isn't the case. I'm curious for Governor and Secretary if you react to that, but also how much does that factor into the decision making in terms of what the Trump administration wants for school reopening?
Well, the decisions that we're going to make is going to be based on the science, the criteria that we've been presented to the public for months now in terms of the percent positive cases on a day-to-day basis, the number of positive cases as a percentage of our population, the severity of the illness as measured by hospitalizations and death rates, and use that as a calculation as to whether our communities are safe in order to educate our children in a safe way, protecting students and teachers and staff. And we have a weekly call with the White House. The Vice President is the point person on that. We have, as part of those calls, representatives from CDC, NIH, Dr. Birx, Dr. Fauci, and we'll use that information and the guidance from the Division of Public Health to make those decisions in conjunction with the school districts in terms of the opening of schools and districts and under what conditions. Dr. Bunting?
I think it couldn't be stated any better than that. We have to look at what's happening in other places, but we're going to use our Delaware statistics to make the final decision.
Hi, I had a question for Secretary Bunting. In your conversations with superintendents, what seem to be some of the biggest challenges that they're facing when putting together these different scenarios and plans for reopening?
They've been working on them for a couple of weeks. They always are concerned about how things will play out. I think their biggest concern right now is into which plan do they put most energy and most expertise. So they're really dependent upon finalizing plans based on decisions that will be made in the next couple of weeks. And the constant conversation, both among the chiefs, and then we've had an internal working group since March 13th, and 3 of the chiefs, 1 from each county, 3 of the chiefs are involved in those conversations. So they have then extra information about the financial status and the health status and all the extra things that they would need to be communicating. So our communication system is quite strong, and I have to give a lot of credit to the governor for frequently having conversations with the superintendents, and that's been going on since the crisis began.
And if I may, we had a conference call with the superintendents this morning, and what I heard from Kevin Fitzgerald was a concern that I think anybody who thinks about it could understand, and that is the challenges of transportation. Mm-hmm. You know, particularly if you're moving children at different times. The challenge of enforcing mask wearing, particularly in a high school setting. How do you enforce that in a way? You know how high school students can be. Challenging situation. And then I think the other one was just the flexibility. And I think that's key, and as long as the districts are following the kind of the general overall guidelines, you know, they're going to have different geometries in their schools. A lot of it comes down with the space that they have. But I think the really positive thing, and Dr. Bunting mentioned it, we've been talking to them almost, I guess, every other week through, you know, for the last 4 months. And so we've developed, I think, a pretty good rapport and at least an understanding that we're all trying to do the right thing.
All right, this question is from Susan Canfora at Coastal Point. What is the governor's timetable for allowing bars to reopen as they were at the end of June, since hospitalizations are going down?
Yeah, I don't think we have a timetable. What I would say is one of the main things that was mentioned, scenarios that was mentioned on the White House call yesterday by the governor of Texas, by the governor of Arizona, in particular those two, and by Dr. Birx, was these venues vacation, summer venues where young adults congregate, party, and aren't as disciplined with respect to the protections. And it's clearly a source of coronavirus spread. We know it is in Delaware because through our kind of interviews and the information that we've received in our beach communities and just observing the lack of compliance, that these are kind of hot spots. Bars are not completely closed in Delaware, let's be clear about that. If they can arrange to have table settings in a bar, they're able to be open. But again, the public health guidelines hold in those situations with respect to social distancing, mask wearing, and the rest. I mean, so we're gonna, look, now our focus is on reopening the schools. It's a pretty strong motivation. It should be a strong motivation for all of us to be careful, to follow the guidance and the restrictions, and to be more attentive to managing the risk.
The next question's from Nick Ciolino at Delaware Public Media. Other states are seeing a resurgence of the virus, and some are even deciding to go back into lockdown. Going forward, will Delaware continue to base its decisions on local data, or will the spread of the virus in other parts of the country have any bearing on our state?
Yeah, I think we follow local data closest. Even sub areas here in our state. We've talked about it at these briefings for the last several months in terms of the poultry industry in Lower Kent and Sussex County, in terms of the outbreak at the beaches. Our closure of bars is just for those zip codes in the beach areas. We do pay attention certainly to states in our region, and it's very positive what we're seeing in New Jersey and New York in terms of their percent positives. I talked to Governor Wolf and Governor Murphy the most. They border on us. I talked to Governor Hogan from time to time, and we follow what they do. And so this problem with respect to bars and restaurants and social vacation sites, hospitality industry sites, and the clear connection with the outbreak of the virus is instructive to us. And we've seen it in our own state, and we're just thinking through what are the ways to control it, knowing that the people who have the virus and who are spreading it are in a demographic where it's not just in these social gatherings, public social gatherings, but they go back and have parties in their apartments, in their houses, and the like. And we just need to be careful about unintended consequences. So yeah, it's a combination, I think, of what's happening in other states, what we can learn from them, certainly the data that draws it. Now, with respect to this particular issue and connection with hospitalizations, although hospitalizations is the thing that I've focused on the most, when it comes to quarantining with Pennsylvania and New Jersey, New York, and Connecticut, they're not looking at hospitalizations at all. And so we can have a negative consequence, and our hospitalizations can be, as they have been, considerably lower than they've been, throughout the peak. But our cases are above the cutoff.
Next question's from Peter Osborne at Delaware Business Times. Have we gotten to a point yet where we feel that we can effectively do contact tracing?
That's a question, I think, for Dr. Rattay. I think it's something. What I would just say is that, again, reflecting on the White House call, and listening to other states, to the last question, are we learning from other states? Every state, I think, is trying to figure out how to make that work.
Yeah, I think we're really thrilled with our ability to have stood up a robust contact tracing system in Delaware, beginning with the National Guard and now with our partners at NORC and Innovational. I'm really proud of how so many partners have come together and stood this up, and we do have the capacity to investigate every positive case and to trace their contacts. I think one of the greatest challenges here and across the nation is a lot of people don't want to take the call and have the conversation with the contact tracers about what it means to be a contact. Many people don't pick up their phones, right? But what we really want to encourage people is to take our call. If you see on your phone a call from DE Public Health, please do answer it. We will be giving you important information, and it's really, really important to control the spread of the infection, that everybody who is either a positive case or who is a contact is participating in this response by picking up the phone and having the discussion and isolating or quarantining as appropriate and monitoring their symptoms and getting tested. So we do have the capacity. It's really important that the public be a part of the solution.
And our ability to do that will again help us open our schools in a safe way and have more in-person instruction, because we'll have a healthier community.
The next question's from Amy Cherry at WDEL. When were the 300 inmates who tested positive for COVID-19 at Sussex Correctional Institution recently added to the COVID-19 numbers? Was this addition across several days? And how can we distinguish between an outbreak at the beaches versus the outbreak at the facility?
Yeah, so I think we're trying to get the answer to that question. I don't know if we have it. Do you have it now?
Yeah, so I have learned that those positive cases were tested at a lab that has not been directly connected to our system yet. So they will be incorporated into our system, but they're not in our numbers yet. They will likely be incorporated into our system on the day that they were tested. So it won't come in as a clump of 300 positive cases. But they are not yet reflected in our numbers.
All right, we have two more questions. This one's from Melissa Steele at Cape Gazette. Will the state offer more financial support to districts that open or go to a hybrid system, or for any COVID-related costs they may incur?
Well, we did have a slide, and see if we can get it up on the board again, that showed resources that were coming from the CARES Act. A significant amount of those resources have gone directly to the school districts. There you go, $39 million of the CARES Act funding, and thanks to our congressional delegation, Senator Carper, Senator Coons, and Congresswoman Blunt Rochester, another $12 million were dollars that came to the states that the districts are making application to the Department of Education on. Well, we will distribute to them. The county executive has resources through CARES Act, as does the state budget office, and we'll be looking at different needs that the districts might have. I think that's part of the next step, is for our budget people and operational people to work with the districts, superintendents, to figure out some of these protective measures and what the cost of that might be if it's over and above this $50+ million.
I might add that I think there's a time here for repurposing funding. I had a call on my way up today. The particular school district had not been able to offer the summer program that was planned. So now they redirect those funds to help with the COVID challenge and what might happen as we go back to school. But that's just one tiny example of how funding that is currently available might need to be redirected for certain purposes.
All right, last questions from Peter Osborne at Delaware Business Times. What happened to our current supply level of PPE if the schools open on time in Delaware? Can the current supply chain handle the increase in testing and cases and the addition of Delaware schools to the mix?
Well, we don't have our PPE expert, AJ Shaw, with us today. I'm sure Dr. Rattay can help us with that a little bit. We have had conversations about it. I think it's fair to say that we're concerned about supply chain moving forward with respect to kind of all the different elements on our dashboard, just because with respect to reopening schools, every state is going to be going through that. as well. So far, we've been in pretty good shape with our dashboard for PPE. We've stockpiled some of it, which wasn't the case prior to COVID-19. Dr. Rattay, do you have anything more to say about what is your normally AJ Shaw's review?
Well, DPH has provided PPE for school nurses, so school nurses are stocked up, or if they haven't, they'll be receiving PPE in the next 24 to 48 hours. And the testing that we expect to be doing with the schools for staff in general no longer is the testing that requires like abundant amounts of PPE. So we don't expect the school reopening or testing to be a burden on the PPE supply.
I might add, too, that through the consortium that the state was involved in, a lot of supplies have already come to the state and been distributed to school districts. So face coverings and gloves, for example, are there in plenty of supply. It would be a question of how long would they be in use? How long can we sustain it?
So in order to, first of all, I want to thank the two doctors, Dr. Rattay and Dr. Bunting, for their leadership over the respective divisions and department. Dr. Rattay, as the director of the Division of Public Health, again, you and your team are doing an outstanding job over a long period of time, frankly, in uncharted waters, a pandemic that we've never experienced in our lifetimes, and we've learned a lot over the last 4 months and continue to plow new ground. And Dr. Bunting, you probably never thought you'd be doing so much work in public health as a Secretary of Education, but nothing more important to all of us than opening our schools. And that's really my message today to the people of our state. The most important thing we do, the most important to our state in the long term, most important thing to our state in the long term is the education of our children, and the success of our state, the success of individuals and families will depend on that. We can't afford to lose a day, let alone months or a year of a child's educational experience. And so getting those children back to school in classrooms with teachers in front of the room safely, so that there's not fear of the coronavirus, so that teachers don't have to worry about catching the virus if they go to school, and children and parents don't have to worry, and they can focus on learning their math, their science, their English language arts, so that they can go on and do great things. It's really going to depend on our ability to keep flattening that curve, to do the things that we've done over the last 3 months. We're not in any kind of lockdown now. We don't have a stay-at-home order. We do have limited businesses. We are simply asking Delawareans to wear a face mask when they're in public, to be careful and cautious of social gatherings and limit social gatherings indoors in particular, and to keep social distancing when in public. We also need you to get tested and to know your COVID-19 status. So if you haven't gotten tested, you can do it and look at the sites available at de.gov/get-tested, so you can know your COVID-19 status. We need to fill up our test sites as we advertise them. We need us also, if you test positive, to help trace the virus. We've learned a lot about the outbreak, particularly in the beach communities, through interviews that we've had with those who've tested positives. And so help us trace the virus by answering when public health calls to tell us who you might have come in contact with, all confidential. And we'll be able to isolate those that are COVID-19 positive and protect everyone else. And if we're able to do that, we'll be able to prevent the spread and enable our children to go back to school in a way that will enable them to be successful in the long term and not miss days of instruction and education. So prevent the spread. Stay at home if you're sick. Wash your hands often for 20 seconds. Use those hand sanitizers when you're going in or coming out of the grocery stores. Wear a face mask, most importantly, or face covering, and try to stay at least 6 feet apart. Thank you very much for joining us today, and we look forward to seeing you next time.